Good day. Welcome to Strong Ambition Podcast. Your host, Rylan Qualley, once again. And today we're going to dive into athletic therapy with Rich Girardin. And he is a good friend of mine. He's been on the podcast before with AJ talking the Whiskey and Barbells. But today we're going to talk more exclusively on his profession around athletic therapy. We're going to discuss the difference between physical therapists and athletic therapists. We're going to talk about, do you need to ice? Should you use a foam roller? How should you use a foam roller? How should you stretch? All these fundamental things that you should understand when it comes to injury prevention or injury recovery. He's helped me for many years with my own issues, my shoulders, my knee. And again, I use his tools to this very day. So let's dive into the episode because you're going to learn so much more. Without further ado, here is Rich Girardin. There it is. All right. Rich Girardin, thanks for coming on the show today. How are you, sir?
I'm good, man. How are you doing?
I'm swell, thank you. Doing good. Finally in the groove after the holidays. How about you? How was your holidays?
Oh, man, they were actually awesome. You know me. I had only 2 Christmas suppers, and it was the best. So unbelievable food and just like a lot of downtime. So I didn't have chaos like a lot of people. Like the people that are going from location to location. So for me, holidays were nice and actually just got to rest, especially being done school. It was a nice break.
Yeah, and I'm not going to pick on you too much for this, but I do think you're one of the, you know where I'm going with this. One of the most unique people that makes holidays extra not stressful for you is that you don't believe in gift giving during the holidays. You believe in gift giving throughout the year, which I think is a very different approach.
Yeah, but this is a 1-hour debate.
We're not going to go into debate on it. I just actually want to highlight, that would be a pretty relaxing time. You didn't got to go shopping, awesome. Right? Yeah, that's way more efficient for sure. Let's dive into why I have you on the show. We don't got to have the holiday debate. We'll do that another day. But let's get you formally introduced because I do a very mild introduction for the start of the show. I want people to know Rich Girardin. So let's dive into who are you, where you came from, and what got you into what you're doing now.
Yeah, absolutely. So I grew up in LaSalle, so just outside Winnipeg here. And then so I went to University of Manitoba for athletic therapy. And the whole reason why I got into that was because I was a big sports guy. I grew up playing every sports imaginable. And there was once or twice I got hurt. And when I got hurt, I'd had to do some rehab. And I thought, hey, I could probably do this for a living. That seems all right. I don't mind this. And really, that's kind of just throughout high school, once I was like grade 10, grade 11, that's kind of the path that I just took, thinking, okay, this is what I think I would like to do. Just because if I can't be on the field playing, next best thing would be on the sidelines, right? Get the best seat in the house. So yeah, that's kind of how I went about it and how I picked that path. And I did my 4 years at the University of Manitoba, and now I'm actually back at the university. And I'm working on getting an MBA. So just want to kind of get that next level up. So, yeah,
getting the business side of things. That's where the real tough part is, but that's where the money's made. But I think it's really cool that you came from, your own challenge. It's where a lot of people end up getting into something they're passionate about, or something that you were challenged with, found some great success in, and then made it into a career. I thought that was a really cool conversation we had at one point, that you said it was just so rewarding when you see someone's like, oh man, my ankle hurts. And then like three weeks later, 4 weeks later, it's like, I don't have pain anymore. To take pain away. Was that like a really big thing for you because it was such a valuable experience for you that made you feel very motivated to give that to others?
Yeah, that's a good question. I would say over the past 5-6 years, now that I've been more in a clinical setting as opposed to a team, 100%. When I was in a team setting, totally different environment. And you felt like you're helping the team, especially when somebody can't play, and all of a sudden the things that you're doing for them, or maybe you can tape up their knee, their wrist, which is able for them to play. And then let's say they get a goal. That's a great feeling, right? Because now you feel like, well, that guy's on the field because of me. But now that I've transitioned more so to working just 100% in a clinic setting, that's where it's very motivating and satisfying. And I can accredit one patient to that, where I felt like I made a very drastic impact on his life, because he was in a horrible car accident, had issues walking up, even up just stairs. And as time went on, he was able to walk upstairs, and then even in his personal life, he was able to bike with his kids, right? Start doing hikes with them, being able to be a more present father. And that made a big difference in his life. It meant the world to him. And it was pretty cool to know that I was the guy that was able to help him when he's been able, like when he's seen other people around as well, right? And no one got him to that point. So that was a very motivating aspect. And yeah, that just, it makes you feel good, right? When you can help somebody, especially to that extent where it's actually a life-changing thing. So yeah.
Yeah, that's really what it's all about, is to be able to get into something that changes people's lives so directly too, right? When you're right there, I think it's really cool when you're in certain levels of customer service. And as a trainer, you get it. As a therapist, when they finish a therapy session, they will say, thank you. And, you know, there's a lot of work that's done that no one says thank you for. And so for you to get that immediate feedback and like, man, you changed my life, that's super rewarding. I'm really curious from your language, because I understand it pretty mildly, but I know there's some specifics and a lot of people might not know the difference between athletic therapy and PT. But can you break that down? Because there's athletic therapy and there's physical therapy.
Yeah. So the way that I always explain it was, so back when, like, I went to university a long time ago now for this, where physiotherapy wasn't a master's program at the time. So between the two, for athletic therapy and physiotherapy, you both had to do 4 years. And the main difference was with the athletic therapy, you spent 3 years specializing in musculoskeletal injuries. So when I say musculoskeletal, we're talking things like bones, ligaments, muscles, tendons, that aspect of the human body, as opposed to the physiotherapists did 3 years, but they spent 1 year specializing in musculoskeletal, 1 year respiratory, and 1 year neural. So they had just a greater scope and understanding of the entire body itself, right? Which is great for those guys, because now there's times where I'm like, wow, I really wish I learned a lot more neural, right? But even when you look at physiotherapy now, it's a master's program. So I guess they do everything within those 2 years. Because I haven't stayed up to date as to what they're doing with on like the educational side of things there now and how that works. But even once you're done school, it's all about continuing education, whether you're a physio or an athletic therapist, because you'll talk to some physios where, you know, they did the bare minimum of neural and that was it, and they never learned it again, and vice versa. Same with AT, right? There's some stuff you just learn in passing, and then it's like, oh, I really got to actually learn this now and take a few extra courses. So
well, that's a really good explanation, and I always remembered it was a scope of practice is the major difference. And I actually try to give it some people some guidance when they have an injury to really consider athletic therapy. And so what would you give people for advice as far as knowing whether it should be an AT or a PT that they seek out?
So my best advice, and I give this to everybody, is go to what works for you. If you've had success with a physio in the past, go see your physio. If you've had a success with a chiro, like whatever it is, whatever gives you success, that's who you should be going to see. The one thing I would discourage is say if someone's like, oh, you know, I've been seeing this person for a year, they're great, but, you know, you haven't had any real results. If you haven't had any real results, well, you're not doing anything to really get yourself better, right? So I'm never one to say, hey, this is better than that, or vice versa. I'm very much all for, hey, just go see whoever works best for you. But that being said, always go see your doctor first. And then once they actually give you a diagnosis, that's when, you know, you can kind of pick and choose. For example, like let's say if you had like a hamstring strain, I wouldn't be going to see a chiro for that, right? I'd either be seeing an AT or a physio. And I don't think one is necessarily better than the other, because I've met some amazing physios and I've met some amazing ATs, and I've met some terrible physios and I've met some terrible ATs, right? So it's, yeah. That would be my recommendation for people, is whoever gives you the best results.
I think you're right on there, that people like have to find what gets them results. I suppose the information I'd want to provide is for people who aren't actually aware, don't have a good physio, don't have a good AT, but even those who do, I think your sentiment there is like, hey, if you're not getting results, question it. And I say that to people all the time. Is like, there is a way to solve your problem. And if you're doing the same thing, it's like, honestly, if you saw the same trainer, you guys aren't hitting it off, they're not matching up, you're not getting the success you want, find a different trainer. But the one thing I was curious about, based on what you said there, is like, see your doctor first. I actually don't encourage doctors unless it's like a big trauma, just because they can save the middleman a little bit. Like if you have like, oh, my shoulder really hurts, and it's like, is it broken? No. it's not a broken bone. I would say an AT or a physical therapist, sometimes a chiro, depending on the issue, because sometimes doctors even just give bad advice, because a doctor can just say, oh yeah, I rested a bit, whereas like an AT or a PT is like, oh, actually we need to stretch it, mobilize it, and that kind of stuff.
Yeah, 100%. Like, so when I say that, sorry, most of the people that I deal with, it's, hey, this has been bothering me for 6 months, right?
Right.
Or it's, hey, that's abnormal. You probably need some imaging, right? Something along the lines. But if it's like, oh, I whacked my knee the other day, and it's been bothering me for the past 3 days. Yeah, you don't need to go see a doctor. Or if, you're like, hey, I was sprinting down the field, and, I felt a pull behind my leg. Okay, that's probably more so just a hamstring pull. Yeah, come see me. But if anything, sorry, I should elaborate, is if it's chronic, like long-term, go see a doctor. Yeah, if it's acute short-term, and it's not anything like, obviously like a bone popping up, then go see your physio, your AT, or whoever. I was going to say, you made a great point earlier in terms of who to go see is who aligns with your goals as well, right? Because you might meet a physio or an AT where they might not practice therapy the way that you like it being done, right? Or they might have different goals in mind for you that you might not support. Same with, if someone went to go see you, where, they say, well, I want to do it like this. And, you're like, hey, I don't do that. Sorry.
Yeah.
Right. So I think it's important to kind of know your scope of practice and what it is that you do. So.
Yeah, and with that, and it can be hard to know when you're meeting a PT or an AT, but I think one of the major things I say is, if you don't already have your PT or AT, is like really talk to people about the referrals.
Yeah.
Like get a good referral. And the other thing I encourage actually a little bit more ATs and PTs these days, and I think this could be biased, but with my experience with you, and is like you spend an hour with the individual a lot of the time, but a lot of PT clinics run a lot of people in, right? So they'll have like sometimes 1 or 2 or 3 people per hour, and they're going to work with you for like a half hour or so if you're initial, but then they're going to run you through. They're trying to run 3 to 4 people at a time. Is that right?
Yeah, 100%. And that's kind of why I've gone into doing practice myself. Because at the end of the day, it's a business, right? Yeah. Unfortunately, and you gotta pay your employees. You gotta keep the business running. So you got to see X amount of patients within that hour, right? Me, myself, I run the business, so I'm not having to split the money with anybody. And I also I don't agree with that model. If you're coming to see me, you're coming to see me specifically. And I think that's something where some people could potentially charge maybe a bit more so that, they only see that one patient. I think some clinics could give a higher split to their clinicians and not be as greedy, right? I know especially with Chris right now, like between the two of us, because Chris is a physiotherapist that works for me. I encourage him exactly that. Hey, see the one patient, you get way better results. Dealing with someone, you get to actually develop a proper relationship with them, to find out what their goals are, and then actually educate them, because that's the most important thing, right? When I see someone, I want to be able to educate them on their injury. This is what's going on, right? So that you understand exactly what's happening, and then why are we doing what we're going to be doing. And then in addition to that, I also want to try maybe 2 or 3 different things to see what's getting you benefits, right? Let's do a little bit of soft tissue work. Hey, did that improve your range of motion? Great. Okay, perfect. Let's keep that. Let's try these exercises. Do these exercises work? No. Okay, let's eliminate that. Maybe that's something we can do down the road. But then at least we've given you a good at-home program, and that you're comfortable with it. You know what you're doing, and that you're going to do it when you're away from the clinic, right? So I believe that 1 hour of hands-on is extremely important.
I totally agree, especially that at-home work. You are an injury trainer. It's like you're the one that's actually going to bridge them into training. And a great deal, you can tell me if I'm wrong, depending on, so sports specific athletes will have a lot more trainers, but a great deal of people who get injured don't have trainers, and they don't know how to have a good bodyweight squat. So, some of the models you see here is they'll have a PT, like a physical therapist, kind of running it, and then they'll hand them off to a inexperienced trainer that's trying to just watch them do their workouts. And that's not a great model, because you don't know exactly what the physical therapist wants. And so when you're there and you were walking me through things like, no, make sure you do it like this. And then the simplest cues of good T-spine rotation, whatever I need. Oh no, reach here, reach here, reach here. And it's like, those cues are important. Yeah. And then that's the homework that's really going to get them out of the situation. There'll be a natural healing process, but to really get out of the situation and into a better situation is the inherent goal. So like, that's why I totally agree with that model. And is it across the board that ATs and PTs are different like that? Or would you say that you're a little bit more unique to that, and some ATs will kind of run through that model too?
Yeah, that's, you know what, it used to be that ATs back in the day, that's what kind of separated them from PTs, was that they were much more hands-on in terms of for rehab, for exercises. Mm-hmm. But now whenever I see PTs coming out of school, they've really bridged that gap. So there's not really that, you know, that big advantage being an AT isn't there like it was back in the day, because it used to be with PTs, I don't want to make a generalization because this isn't everybody, obviously, but generally speaking, back in the day, it used to be, hey, you hook them up to like a modality. Here's some stim, here's some ice, here's your 2-3 like stretches, and there you go, you're done, right? As opposed to now, it's much more hands-on. It's in the gym, and you've seen exactly with Chris. That's all he does now, more or less. He doesn't really do any modalities whatsoever. It's all gym work. So, and it also depends on who the therapist is too, right? You might get some who really believe, let's say, for example, in acupuncture, and that's a big part of their practice. And then you might get someone who doesn't want to do any of that stuff at all, right? So it's really, everyone's so individualized now. And there's so much information, so much access to information now with the internet as well. So it used to be that, but now it's kind of, you know, it's hit or miss. I find most of them are in the gym for the most part, any new grads.
Yeah, I remember talking to Mel Skabinski about this. She says it's getting to be more of a priority for physical therapists to get people moving. Like, movement is the therapy itself. And I've heard this before I actually remember learning it in school, that after an injury, just fundamental range of motion is one of the most important things to reestablish. Tell me if I'm wrong, if I'm making this up, but I remember hearing about a very aggressive form of surgery. I thought it was ACL reconstruction. And you may or may not have heard of it, but basically they would do the ACL reconstruction. They would put the patient out, and they would, within the first week, I might have been the first 48 hours or so of it, and they would actually move the leg, because the person needed to be knocked out because of the potential pain, but they would actually move the leg in a range of motion within the first 24 or 48 hours. So they got the range of motion, and it sped up the recovery of the ACL surgery. I'm not sure if you've heard of that, but I remember hearing very distinctly that there are surgeries that they're doing this in more advanced way. It's expensive, and I imagine there's also, it's new, but on a fundamental basis, it makes sense, right? We want to do as much movement as we can without pain. Mm-hmm. And that can actually help recovery, because one of the problems is when the injury site has too much rigidity and it gets too stiff. I don't want to speak out of turn. You're the expert here.
No, I don't know specifically for that instance. It wouldn't surprise me though. I'd have to actually do some reading on that. I do know, for example, I look at my dad who got a knee replacement. At some point, they did get locked, and he kind of hit his max where they did put him under afterwards. But this was far after the surgery, and tried to start manipulating it to break down any kind of scar tissue, get that full range of motion. So you might be onto something there. That I'm not entirely sure of. I know all the ACLs that I've seen and dealt with, it's always been just your natural return to range of motion. But you are correct 100% that is, it used to be that rest was the big idea, right? You get hurt, or you had back surgery, hey, you're in bed rest for X amount of weeks. Now that's not the case. It's always, okay, get up and moving. They want you up and moving as fast as possible. So if you just had that back surgery, get up, get moving, go just for walks. They want to see you getting moving, right? As opposed to laying up in bed for an extended amount of period of time, because that's not doing you really any good.
Right. It's this nice catch-22 in between, right? People can get too rigid, too soft, cause more problems down the road. but you have a new injury. You have to reserve just the right amount. Where can you make it just kind of move the right amount? Because you need that range of motion. It needs to feel useful, but it's also like, I remember when I recovered from my shoulder, the one thing I did do well, and it was the simplest thing, was I actually went for walks without my sling as soon as I felt my shoulder could handle it without a lot of pain.
Yeah.
And that's kind of like doing the pendulum swing itself for the shoulder, right? Like if I just go on there and it's like, okay, my shoulder can handle it. And I felt like just fundamental capacity came up that much better after my surgery because I was just willing to do a little bit. I want to hear you touch on some other fundamental things here that could be misconstrued. Immediate injury, for example, is ice. Is ice still really important?
You know what? It's crazy. I was just talking to AJ about this. It's crazy to me when I look online, like all the social media where it's, hey, like you should never ice. Or, you know, it's like, hey, this is why you should never bench press. Or like, I see so much stuff, and it's kind of mind boggling. And I know ice is kind of one of those controversial ones. I just watched a guy on E3 talking about this because someone on there's another like social media post. Someone was saying, hey, you should never ice. And they were saying like studies. And then the E3 guys were saying, well, which studies are you talking about? Because there's only one study that you're referring to, which was done on mice as well. And it wasn't like in an acute phase. It was something like that. So it was still saying that ice is still good in acute settings. And I've always believed that myself. And as you know, that's kind of one of the complicated things. That's why I never really give definitive answers when people ask me questions. Like, as you can tell, I always find that my answers are always maybe. Right? Because like, unfortunately, like you'll see like an article saying, hey, this is like, you know, the next great thing. And then there's some research on it. And then, you know, hey, turns out that didn't work great. And then 10 years later, it comes back in style again, right? Where it's, hey, there's some new research where, you know, this could be beneficial. So I've always believed icing in an acute setting is where it's at. And I believe that for a few reasons. So I want to say in acute settings for those first 72 hours, I always like icing injuries because I want to decrease inflammation. I do understand that inflammation is the process to healing. But that being said, I find with icing, I want to try to reduce any kind of tissue damage. I want to reduce pain as well. And I find that by reducing pain, you're able to get people to move earlier. Right? As opposed to, let's say you put some heat on it, you're bringing some inflammation to it. Yeah, that swelling and that inflammation is going to help heal the injury. But let's say if you sprained your ankle, good luck walking on it with all that pain, right? So now I can make the argument that you're actually going to be further behind in your rehab because the person who was icing it wasn't having pain and was able to start working range of motion, which got them back sooner as opposed to the person that had the inflammation. I hope that makes sense.
Yeah.
But like even me, myself, when I've hurt myself, like I feel great using ice. So I use ice. Down the road, once it becomes chronic, then it's heat. Because you want to bring some blood flow to that area, get some mobility where it's feeling good. The same as kind of a warm up in the gym, right? And bringing that blood flow to the area so that, you know, it can heal. So in that first, you know, 2 to 3 days, I'm icing injuries, and then everything afterwards, I'm using heat. But that being said, as I've stated before, if it feels good, do it, right? If you say, hey, like it feels great when I ice my shoulder before I work out, okay, then do that. If that's what works for you, do that. But generally speaking, I wouldn't give that advice. I would always just say ice in the initial phase of an injury, and then use your heat afterwards.
That makes sense, especially when it comes to the context of getting the movement in. I always looked at ice as just simply like a really good pain reliever. But I thought it was interesting that you said the first 72 hours, because I was under the impression more recently, but you probably follow the research better than me, that within the most immediate acute, you almost want the inflammatory reaction to do its job. And then I would look at it as more of like let's say, you know, the injury just happened. It is a sprained ankle, and the person says it hurts a lot. Now, this is just my understanding interpretation of it. Potentially, you don't put the ice on it, they're going to be in a bit more pain, but they're mostly going to be resting within the first 24 hours. Now, the next day is where I understand that, ice would actually be effective. It's like, could we ice it and get you to walk a bit? That would make a lot of sense. And then saying to ice the whole week, I don't think could be as productive unless the person is like, man, this is just irritating me at the end of the day. I'm really tired. It really hurts at the end of the day. And it messes up my sleep. Well, definitely ice it before you sleep then, because you're probably going to get a more restful sleep, and sleep is your recovery agent. So that's kind of the principle I follow. I thought it was really interesting that you had said that the classic, so they have these sayings in therapy or first aid, which is RICE, which is rest, ice, compress, and elevate. And you had mentioned that they took ice out of that model. Is that still true?
Yeah, I think now they go with, and I'm not up to date on this, but I think it's like peace and love. It's something like that. Yeah, it's something. I'd be interested to Google it right now. But I think it's something along. I saw those acronyms just the other day. There's something along those lines. I didn't know what that entailed. If it was, pressure, rest, elevation, pressure, elevation for the peace. Okay.
I'm looking this up here. I'm seeing
is it there?
Now. Okay. So Physiopedia, the two acronyms. Peace and love principle. The old principles of Rice and police. So peace stands for immediately after soft tissue injury, do no harm, let peace guide your approach. Minor soft tissue injuries may need peace in the acute phase. P to protect, E to elevate, A, avoid anti-inflammatory modalities. Avoid anti-inflammatory modalities.
There you go.
Compress, educate, and love. The love. The love actually is his own recommendations here. After the first days have passed, soft tissue needs love. Load, optimism. Wasn't expecting that.
That's good. That's actually good.
Yeah. Vascularization, exercise. I kind of like these. I just think it sounds so politically charged. It's just like peace and love is now in our settings. It's like, when you actually look at it, it's a good principle. It just sounds like that was a political model right there. But that's interesting. So again, this comes back to, they do note like the anti-inflammatory. So
they mention it in there. I do know there's the research that does support still icing it, but like I said, I do know there's been more of a push not to. But it's like I was saying, like we were talking about like ice baths as well, right? Where I remember 10 years ago, everyone was, hey, ice baths are where it's at. And then I never heard anything about ice baths. Like they had just gone by the wayside, and now everybody, like it's just incredible the amount of people now that they're doing ice baths for all the physiological benefits to it, right?
But that's because of Joe Rogan.
There's a million different
there's a pretty good model there that actually amplifies a lot of these things, and I think that's a big part of when things go to the wayside, and then you have social media, and then they come bring out biohacks. Biohacking is now a new hobby, right?
So I do see down the road potentially, who knows, maybe icing will come back. I know like in Major League Baseball, they never ice, or I shouldn't say they never ice. The vast majority of teams now, they don't ice at all. They just do compression after, like for their baseball pitchers and things like that. It's always changing. But like I said, what's
the benefit to compression?
That's a very good question. You'd have to read the 50 articles that are to it. I'm not that deep into it. Okay. So I can't. I don't even want to speak on that aspect of it because I can't go into it. I've listened to one or two podcasts. The guy that started it all, I can't remember his name. I'll have to give you that information. But it's actually, I listened to him talk, and it was interesting. I could see the benefit to it. I think it was more so just to push out any kind of swelling and fluid that has accumulated from a recovery standpoint, because those guys have to pitch, 2-3 days later. But I can't give you great detail on that one.
I think from what I remember, it would just be quicker venous return, right? I remember AJ was talking about like doing like the compression skins and stuff like that, and then all of a sudden his workout he wasn't sore from, but that if you're talking about hypertrophy training, it's the same thing as ice. You're actually pushing out that inflammatory response. Now, if performance is your goal, inflammatory is not your goal, right? You actually don't want hypertrophy. You don't care. You just want to perform within the next 24, 48 hours. That's where ice baths are not useful. And then if you're not worried about performing and you want the training benefit, you would encourage the soreness. You encourage the inflammation.
Yeah, exactly.
And you do not want to compress. So, I think and again, I just love your initial answer. If it feels good, do it. But I think what I like to kind of amplify for people is don't feel guilty if you didn't ice. Like, I think of all the things, like, that's the one thing is like, oh, I didn't get an ice. It's like, hey, don't worry about it. Like, if anything, just ice when it feels good. And other than that, just focus on trying to get some help on it. I'm curious of some of the other modalities, because roughly explain some of them, because just out of curiosity, and people might be interested in it. So, for example, just because you go and do these things to people in the therapy office, and they might not know what it's doing. So I'm curious about, like, for example, you had said the muscle stim, and so people know that would be the thing that's kind of pulsing their muscles, and what is that doing for them? How does that help them in a therapeutic sense?
Yeah, so for stim, there's a few benefits, and it all depends on the settings, because you can get a whole bunch of different kind of settings, right? Generally speaking, when you have your IFC, that's just your gate control theory. So gate control theory, you bang your head, first thing you do, you rub it, right? So you're distracting the pains, right? You're stimulating different nerves. So that's just the same thing, where we're just trying to reduce any kind of pain that you might have in the shoulder or a knee, so that you can just get through your workout or get through the day. So that's all the stim is. So I keep looking over to see if someone's opening the door. So that's all that stim is. But there's also other factors. You can have like a Russian setting on there. And so that's actually firing off the muscle. So that's great. So for like muscle re-education, if you're coming back from an injury where, for example, you're trying to get your quad extension, right? But you don't, like, for those who have never had that injury, like sometimes you have a hard time extending that leg. So if you fire off like a Russian for the stim, like that setting, it will actually contract the muscle for you if you go high enough, right? So when you put that on, you're also trying to activate the muscle along with it. Right. So it's a bit of that re-education. So then you also have some stuff as well that help flush the muscles. So there's different settings on a stim machine itself. And then, there's so many modalities you can go into, like even like your ultrasound. I know ultrasound has fallen by the wayside, but there's limited evidence to support that helps heal an area faster, affects cell permeability. Also, the other settings that you can do on an ultrasound is for heating. So it penetrates deeper, deeper than a heat pack, because a heat pack will just heat a muscle superficially, but as opposed to an ultrasound will penetrate even deeper down to that muscle, right? To try to get some of that blood flow to the area itself. So, but nowadays, there's so many modalities, even, all your scraping tools, your dry needling, acupuncture, you have your massage guns, massage itself. I'm a big massage fan, soft tissue release, just so that you can get some blood flow to the area, try to break down any kind of scar tissue if you can, but once again, you'll read limited evidence on how much scar tissue you can break down. There's all that, right? But there's a lot of benefits as well outside of that, right? Just trying to reduce any kind of tension, really, it comes down to, so that you can get someone moving again. So,
Yeah, I think even like with the whole thing with like acupuncture, heating, all that stuff, a lot of this has to do with more how the body's going to feel after. And then we come back to what we had originally started, is like getting to move after. So this kind of rolls into, I just wanted to ask you, have you used a massage gun before?
Yeah, totally.
I was just going to say, is compared to like foam rolling or, lacrosse ball, better, worse, same? Like, because I just was debating buying one, so.
Yeah, that's a good question. I have a Theragun. So a Theragun has more compressive force, so it gets down deeper. I don't think I think they're all equally the same. I find with the Theragun, I would call it the lazy man's rolling, right? As opposed to like when you're rolling, like you actually have to put some work into it to actually do it. As opposed to like a Theragun, I can just hold it right here and then do what it has to do. I don't think it does as good of a. You can adjust the pressure yourself on it. But I find that myself, I feel better after if I do rolling with like a lacrosse ball or a foam roller as opposed to a Theragun. But yeah, Theragun works great though as well. And I find more people are inclined to do it because it's much more passive as opposed to rolling out, right? So especially for older populations, I find like a Theragun is like so good compared to like for a younger population, because for an older population, harder to get into certain positions for rolling, as well as just tissue bruising as well, right? So it's a good introduction to then rolling if you want, right? With like a lacrosse ball and all those things. But I do like it. And I think I find that it's really good actually for warming up. If you want to get like just hey, I want to get a little bit of activation here, I find, and get some blood pumping, I find that they're good for that. And they're pretty dirt cheap now. Like you don't have to get like a Theragun or the Hyper Rice, like the top of the line ones. You can get like some pretty dirt cheap ones. They're not as nice, right, and less bells and whistles. But I definitely think it's well worth it if it's something that that you would actually use, right, compared to rolling and all that. But a lacrosse ball costs you like $3. Same with the foam roller, right? You can just buy some PVC piping, which is all dirt cheap, right, compared to. But if you want to shell out the extra $50-$60, then yeah, for sure. I definitely see a place for them.
Yeah, I've even seen them at therapy clinics where there's like, do you want to just use it's like, to me, that's so much easier for a massage therapist. Yeah. And that's also when let's say you don't always want to shell out the cost for a massage, you have a partner, but they're not actually great at giving you, like Angelina's been straight up. Like she used to give me massages all the time. And then I was like, you're not as excited for us doing massage anymore. And she's like, Rylan, you have a lot of muscle in your body. It's a lot of work. And I'm like, okay, I need to get a massage gun. I think it'll be easier for her. But I wanted to go back to, all the other ones like lacrosse ball, foam rolling. What is that doing for us and when should people use it?
So a few things. I find that it releases the tension in muscles. Like I said, you'll find so much evidence now saying, hey, this doesn't work. So there's so much, I don't know. It's hard to kind of talk about on it. Myself, I like using it like in the certain situations. It's to loosen up, it's to get warmed up, to get added mobility. Like I like doing rolling out to bring some blood flow to the area, to release any kind of tension, and then I do my active, like dynamic warm up prior to any kind of activity. But that being said, you also have to be careful with that, because let's say you roll out, your calves, and now you have this newfound range of motion and you're going deeper in a squat, but you don't have the stability to match that mobility. Now you're in a danger zone, right? You run the risk of hurting yourself. So you do have to be careful, I find, prior to activity with it, and that you make sure you get a good dynamic warm-up. But I like it personally to use it outside of like your workouts, to when you're working on a mobility program. That's when I find it's the best, just to kind of ease any kind of tension, any kind of muscle spasms. Sometimes I find it helps. And then working your stretching, right? Because now you're nice, loose, and limber, and then that muscle can get a greater stretch once you've done your rolling out.
Yeah, just fundamentally, it's even like the best step before the warm up, right? And the way you said it just kind of gets that blood flow. And the way I almost understood it is that in some sense, it's going to release tension, but it almost numbs the muscle. And it's kind of similar to how static stretching can, basically, it got me there. Static stretching will have the effect of basically, or actually I would say PNF stretching more specifically, where it overrides the system of the Golgi tendon, right? So it's actually trying to make your neuromuscular system not pay attention as much. And if you just push on something really, really hard and then you release it, well, now it actually wants to release. So you got the blood flow because it's going to signal that because it had the pressure there. But now you go to do your dynamic stretching, some mobility movements, and you go to do lifting, like just that little bridge into it. The muscle or the nervous system is almost a little bit numbed to the range of motion in like a productive way because you're going to use it productively. I want you to go a little deeper though on that stability thing because I thought that was interesting. So you're to kind of play on that problem. You improve your range of motion of your ankle and by like rolling out your calf, but then there would be an inherent risk for stability after. Can you kind of go deeper on that?
Yeah. So let's say, for example, you have a hard time getting down into a deep squat. Let's say you're doing deep squats, right? At your ass to grass. But let's say you don't have quite the mobility for it because you don't have great ankle dorsiflexion where your toes can come up. But now once you've rolled out your calves, now you're able to get deeper. You have that ankle dorsiflexion, right? So let's say you have 225 on your back, and now you're going into a deeper range of motion that you've never been into. So your body doesn't have the capability, the stability to support and hold that 225 on your back, right? Because you're now in a much deeper range of motion that you've never trained in. So that's why you got to be careful sometimes with doing your mobility work prior to your workouts. I find because you can risk an injury with that, or even let's say you're working T-spine rotation, right? And now you're getting really heavy medicine balls where let's say you're going to 45 degrees, but now you're going to 60 or 50 degrees of rotation. You're going so much further out in your rotation that you could run the risk of an injury because you don't have the stability of the strength in that position because you're now vulnerable because you've never worked within that range of motion, right? So that's what I mean when I talk about your stability versus mobility. So it's great to get that mobility, but you got to also be conscious that if you've got this newfound mobility that you've never worked within, you got to train and build up within your strength within that range of motion, right?
Yeah, this falls right into the next topic I want to talk about, which is the difference between flexibility and mobility, right? So this kind of would be the example of, oh, I stretch my chest like statically for 2 minutes. Oh, my chest feels so loose, big range of motion. Let's go hit bench press. And so it's like you have this massive range of motion. And yes, you stretched it out. That doesn't necessarily mean you have the stability and control and you're going to do that necessarily well. As you had mentioned, you do the rolling, the foam rolling to get the tissues warmed up, but then you do a mobility exercise and then you would actually want to make sure you're programming your training appropriately where you're growing into these range of motion very progressively. But let's talk about kind of what you had really nailed there is it's one thing to have the range of motion, it's another thing to have the stability of motion. So let's kind of touch on it. What's the difference between mobility and flexibility?
Well, I guess it kind of depends on the individual's definitions. Like flexibility to me would be more of a just in a static position, right? Can you just bend forward and touch your toes as opposed to, let's say I'm trying to think, let's say you're a kicker. Can you actually kick a ball and then get that same mobility mobility with your foot going straight up? That's the way I would look at it. From flexibility and mobility, I'm sure I don't know what the actual terms are, but that's the way I would view it itself. I think that's correct on it. So that's really the difference between the two. But the other thing too is you have inherited movement patterns. Like there's some people who can't touch your toes from a standing position, but when you get them seated, they can touch your toes. So are your hamstrings really tight? Your hamstrings aren't tight. It's just that there's a certain motor pattern that you don't have anymore that you got rid of. So that's the way I would look at your mobility is, do you have a controlled range of motion as opposed to just in a static position?
Right. Yeah, I really like that. Yeah. And it's super important people recognize this. So common thing that people will say when they're worried about injury prevention is they'll say, I got to stretch more. I just don't stretch enough. Yeah. Now, is that inherently the problem that they're doing or what else could they really be thinking about?
Yeah, I think a little bit of both there because, you do got to stretch more. I would say, like, let's say if you can't just bend down and touch your toes, well, then, you got to work through that movement pattern and get that range of motion back. Now, is that an issue with a motor pattern or is that just a true, like, flexibility problem that your hamstrings are tight? Yeah. So, sorry, repeat your question. Again,
Yeah. Well, how would you respond to someone saying that they need to stretch more in terms of injury prevention? Is that really the whole
yeah.
solution?
Yeah, it could be one of the solutions. I won't say it's because everyone's so unique. Um, Everybody's different, and you might have more ankle mobility compared to someone else because of what you do for work, right? Let's say if you're always squatting down. So I do think it is important to find out what is restricting you, but also finding out what the normal range of motion is. Because you might be hypermobile, where some people feel like I've stretched out some people where they're saying like, hey, my hamstrings are really tight, and you're doing a straight leg raise with them, and their leg is damn well near their face, right? Where it's like, no, you don't have a mobility problem, right?
Yeah.
Like this isn't tight. You don't need to stretch more. Someone like you needs more stability exercises, and that's why you're probably feeling like some activation, and that's why you're feeling that tightness in those hamstrings. But someone where it's like if you do a straight leg raise and they only get 30 degrees off from the ground, well, yeah, you need to work on that range of motion, and that's something that could lead to an injury. Whether you go into sprinting, or let's say if you don't have like groin flexibility and you're skating and you're coming across the blue line and you go beyond a normal range of motion for you, now you're going to get a groin strain, right? So yeah, I think it's important to find out what's our normal ranges of motions in your day-to-day life or your sport, and then working on those. And yeah, I definitely think there's a massive benefit to that and preventing injuries.
I really like that because you really came to the whole sentiment of what's the normal range of motion for your sport. You have to recognize the problem in your sport or your movement patterns you're trying to do, whatever kind of training and stuff like that. And that there's a continuum. It's not just, some person can be really tight. Some people can just be unstable. And it makes sense because people think that they have these problems, and it can be really, your example there is really good. When someone can bend over and reach their toes, or can't reach their toes, but you put them on the ground, they can reach their toes. It's like, well, that's weird. It's like, clearly it's not a flexibility, and that's how the body works. It's a nervous system thing, that there's actually some patterning of your nervous system that actually goes into it. And so what kind of methodologies, let's start with more of the difficulty in the range of motion. If they start to see that it is a range of motion issue, what kind of routines do you encourage them to do to practice to improve range of motion?
Yeah, so I kind of follow a lot of the Gray Cook stuff. I like his stuff when it comes to it. So I do your mobility, right? So you're rolling out whatever it is, your massage guns, whatever is going to get that tissue nice, loose, and supple, bring some blood flow to it. And then once we've got that blood flow coming to it, that's when I want to go into your stretching, right? I want to try to elongate that muscle. And then once you've elongated that muscle, I want to do some sort of a movement pattern along with it. So for example, like your T-spine rotations, right? Your around the world, whatever it is that you're doing for your movement, it's kind of hitting save on that document, right? For your brain, where it's like, hey, dummy, you've got this newfound movement. So like for a great example would be anybody that's listening, or you yourself. Let's say if you do a lot of stretching and for your hamstrings, and then you're like, wow, I got all this nice newfound range of motion, and then 1 hour later it's gone, right? So it's the same thing where if you roll out, you stretch. Now once you do some movement patterns, you're hitting save on that document, and you're reinforcing that movement pattern in your brain, where it's, hey, you now have this newfound range of motion, let's use it, right? So that's the way I always like doing things. I like rolling out, stretching, and then some form of a movement pattern in order to try to keep that new range of motion that you have.
Yeah, the usage is what actually, like you say, it's the hit save on the file. It really just makes it an important thing to adapt to, because otherwise you just, unless you just constantly, like, you would have to do a whole lot of static stretching constantly for the body to really remember much. But if you do that little movement pattern after, and sometimes it's even a stability movement, for myself, I'll do like big active range of motion stuff, like you say, the T-spine, all that. And then if I do, kettlebell overhead carries, it's like now my body's like, actually, he does use the overhead position. He's not just turned over his shoulders all day. And that part is really important because, like you say, it's saving a file. It's sending knowledge to your body that you're going to use this, and that's a really important thing. And so, like, what other kind of methodologies, because I mentioned kettlebells, or any other kind of ideas that people should be thinking about when it comes to how to use it? Or could it be just fundamental movements like push pulls and squat and hinges?
Yeah, so your basic, you have quite a few, like you can look up, there's a number of movements, like basic movements that you can do. That's not even with your kettlebells or anything along those lines. It's just, for example, if you do, like you want ankle dorsiflexion, just going like knees to the wall where you're flexing it like towards it. Just stuff like that. For hamstrings, I like just putting one up into a door frame. Like you're doing kind of that scissor. Like I feel like you've seen me. I don't know how to convey this so the listener.
Yeah, scissor makes sense. You put one leg down, one leg up on the wall.
But then you're moving the leg that's down, that's coming straight up, that's now parallel to the one that's up on the wall, and then back down, right? So now you're actively using the one while you're stretching the other side, right? And then you flip. All your T-spine rotation, there's a million stuff that you can look at for T-spine rotation that doesn't require any kind of weights or anything like that. The other thing I was going to say, PNF stretching is the best stretching. That's where you'll see your most gains from. So if you have the opportunity to do PNF stretching as opposed to static stretching, that would be the recommendation. But that being said, there are benefits to static stretching as well, right? So you're not going wrong with doing one versus the other. So, but there's definitely benefits as well with even kettlebell stuff, right? Where you're just packing the shoulder, like overhead walks, right? Like that kind of stuff's great. So
I wanted to explain PNF stretching a little more because I love it. It's super important. It's actually part of using the muscle. How would you explain to someone to do PNF stretching?
So when you're actually doing it, what is it the correct? I gotta think of the correct aspect of it. Is it the 7 seconds that you're doing push for? I think it's 7 to 10 seconds. I think minimum 7 seconds. So let's say like a hamstring straight leg raise. You're going to your max range of motion, and then ideally you have a partner. Partner is the best and easiest way of doing it. And then you would be pressing down, trying to bring your leg back to its original position. For that 7 seconds, pushing, driving down. And then after that 7 seconds, you relax. And then you're going to actively bring that leg straight up a little bit further to a new range of motion. And then you're going to hold, like you have a partner there or a wall, whoever, and you're just going to rest it at that new position. And then you're going to repeat that same cycle 3 times.
Yeah,
or so more if you want, but ideally 3 times. Yeah.
Yeah. Contract, relax is what I always explain to people. Is make sure you found the range of motion, contract it, then you can relax, and they're going to push you a little deeper and super effective. It feels somewhat painful, but you're also like, wow, how far of a range of motion you can get when you actually do that. So it's super helpful.
There's nothing wrong with like even static stretching. Like static stretching is great. And that's the easiest one to do. But at least doing it for a minimum of 30 seconds. They say 30 seconds to a minute is the most optimal time. I always tell people a minute just because if you tell them 30 seconds, they're going to stop after 15 seconds, right?
I actually thought it was longer. I thought you could still get benefits up to like 2 to 3 minutes, but you're saying that like more than a minute isn't as beneficial?
Yeah, I remember reading on the NASM website on their corrective exercises. They were going based off studies. They were saying 1 minute's optimal, like 30 seconds to 1 minute. And then above 1 minute, there wasn't like a huge return on investment on it. But that, like we've kind of said, there's always new research coming out every day. Yeah. Like, you could be telling me something that just came out a while ago, right? As like the last time I saw this was like a year ago. So yeah. So for your PNF, like 7 seconds, I think it's 5 seconds. I think that's the minimum. But yeah,
that makes sense. And then people can always use bands for static stretching if you have a partner, which can actually use the PNF or just to actually enhance it. I really recommend that. One of the things that I always say that yoga does best, or actually there's 3 things. It puts you into a stretch, then it actually requires you to stabilize, and then breathe deeply. So it actually hits your nervous system on all three realms that you want to improve range of motion. And that's why it's so effective. Plus, it puts you sometimes in a hot environment where you'd be much more limber. So you're getting a range of motion, like you're pushing that, and then you're actually stabilizing that big range of motion. And then like the breathing is actually really important, because if you breathe in a stretch, that's going to signal something to your nervous system to calm down and to be comfortable with it. So I always felt like that's why yoga does all these things that we're talking about so well.
Yeah.
But yeah, I just an anecdote there on the effect there. Now, I would love to know if you have any other top ideas, like whatever comes off your head, as far as what do you think more athletes or strength training athletes should probably know about injury prevention or recovery that they don't know, that doesn't occur to them?
Yeah, that's a good question. I'm trying to think. I got to think off the top of my head here on that. I find the biggest thing is really just taking care of your body. Like if you have any lingering injuries, this is kind of more general population or your athletes that don't have access to, therapists 24/7. Like I'm thinking about like your professional teams, they have their own guys. You don't got to worry about that. But, someone that's coming into your boxing gym, for example, anybody that has anything, even if it's just a lingering injury or it's like, I kind of messed up my shoulder X amount of years ago, or it kind of hurts when I do this, go get it checked out, right? Go address that issue, because that's one thing that's always going to be hindering you, whether you think it or not. You've just adapted to that pain or that limited range of motion. So someone can help you break through that, right? To eliminate that pain or find out what's causing that pain, or even just get you into a proper range of motion. For example, like I imagine like with you guys, like with some of your athletes for boxing, like if you don't have good trunk rotation, right? Like to follow through on a punch, you're doing yourself a disservice because you're not going to be able to generate more power. So yeah, I guess my main advice would just be if anyone if you have any pain or any limited range of motion, to go get that checked out. And if you're not sure, you can always find out. You can find that research on what are the proper ranges of motion, or chat with a professional about it. In terms of recovery, there's so much stuff. I know you do quite a bit of stuff like with your clients, which I think is all great. But I can't think of anything off the top of my head besides that.
Mm-hmm. Yeah, well, I really think it's valuable for people to just hear. Make sure you get it checked out. If you have a problem, it's like I always tell people, it's like the cold principle, that if you have a cold, and typically a cold could last anywhere from 3 to 7 days. Let's say it takes 7 days and it's gone, then you can handle it. Your body can actually adapt. But if you're and like an ankle could be the same way. You have a strain in your ankle. It's like, I kind of rolled it. And then if it's better in 7 days, hey, your body adapted. It's actually just that one in particular day. But it's like, I've had a cold for about a month now. Really? Yeah. Are you sure you don't have pneumonia? Because maybe go check that out. And the same thing with your ankle. It's like, I've been like limping off my ankle for about 2 months now, and it's really swollen and bruised. It's like, now I go see a doctor.
Yeah, well, there's that, and there's also like just compensation patterns, right?
Yes.
Like if you hurt your ankle, your body's going to find a way to work around it, and then you're going to be moving differently, right? So the main thing when I say this is just figuring out that you're not putting yourself at greater risk now that you're in whatever activity. Right? Like people that have neck injuries, it affects their hand grip strength, and they might not even realize it, right? So that's a good test that you can do, is just figuring out what your hand grip strength is, and then seeing down that pathway if there's an issue along the lines. So that's just kind of like that's bringing down your performance without you even realizing it, that hey, I'm losing strength in my hand due to a neck injury, right? Like people don't put 2 and 2 together with that sometimes. And like the whole reason why I say ranges of motion is because, for example, your ankle is a very mobile joint. If it doesn't have mobility, well, guess what? Like it's going to move up the kinetic chain. And so something needs to compensate for that mobility and gain mobility. So it's going to happen at your knee, and your knee is a stable joint, right? So that's where you're playing a bit with fire sometimes, depending on your activities. And something that, you can get someone to check out and do some just quick screens. But that being said, the counter to that argument is that sometimes those compensations is what makes you such a great athlete.
I'm glad you raised that, because that was actually something you mentioned on the last time on the podcast is we don't, I just love that you mentioned that, because it's like, it's important to understand that the body is a kinetic chain and that things down the chain can cause a problem at the joint. So, your ankle issue could actually be caused by your knee or your hip, and vice versa. Something in your ankle could cause some issue in your hip. Yeah. But at the same time, then we can get really obsessed with, you have a little less, tibial rotation here, and you don't have as much external rotation here, and you don't have this dorsiflexion. It's like, watch a hockey player walk around the gym. Watch football players' hips and how much they're pelvic tilting. And it's just like, these are, and you mentioned it on the podcast, these are the best compensators. These are the people who actually compensate the best, and they perform very well. Now, the thing I always kind of look at it is, your body's going to compensate in a sport the best it can, and all sports are pushed to the extent where your body doesn't break down. Like that's just really your goal. So in hockey, you have certain patterns that are going to benefit you, but it does put you at injury risk, because it inherently would if you go too far down that spectrum. So you're just trying to maybe, as a general concept that I give people is like, you still need to own your compensations or use your compensations, right, within your sport. But at the same time, you just want to actually still be close to a well-balanced human as much as you can. Like it's not to be anatomically perfect by any means. You still got to be you. You still have to have your own body language, so to speak.
Yeah, I was listening to Greg Rose talk about that. He's the guy that runs the TPI performance, like for golf. And like he was just saying, I thought it was interesting. I thought it was a great point. He was saying, like, for example, the golfers, like, why am I going to try to make you swing like Tiger Woods when you can't move like Tiger Woods, right? Like, let's find what works for you. So I thought that was like really good advice, right? That, hey, I understand you want to be like this person, but sometimes you can't. And even if something's wrong, like you look at somebody that has flat feet, like there will be tons of people that will debate this, but if it's not causing you any issues, why am I going to try to fix something, right? Like, why am I going to try to fix your flat feet if it's causing you no issues and it's not going to cause you any issues down the road? Right now, if that flat feet is causing you issues at, your ankle, knees, or whatever, well, now I'm going to try to fix that, right? But if it's not causing any issues, what are we doing, right?
Yeah, you want to look at the most appropriate problem at that time, and there's going to be compensations in individuals, and the body's super adaptable. You'd see people amazingly without injuries, despite you looking at it, and it's like, man, like actually, Floyd Mayweather's a good example. I've seen photos of him and how high his left shoulder is, and because of his, his Philly shell style, and he's like this, and he's just kind of brings his hands up. Now, you always got to remember there's exceptions, not the rule, but the far end of the extreme, that the body can adapt. And I don't remember him complaining about shoulder issues. I don't remember him having rotator cuff issues. And I had a slight variation in mine, and my rotator cuff went. So I had a problem in my rotator cuff given who I am as an individual. And that's just something that you have to really approach. But I think it's helpful because, people get too caught up in the different topics around injury prevention or, rehab and all that stuff, especially with social media. You can get too obsessed with having this perfect symmetry. And I think it's important for people to understand that there is a kinetic chain, but we don't need to be obsessed with it unless it's causing an inherent problem.
Yeah. Or if you want to improve your performance down the road, like you might be able to figure out, hey, if I gain more range of motion, in my hips, I'm able to generate more power, where that's something that you can work on down the road. But it's not something that needs to be fixed immediately at this point in time, right? It's something that it will take time, and it's something that you can work on over time. But it all depends on what your needs are in life, right? Yeah. Like if you're just, a weekend warrior, do you really need to be able to throw, a baseball 100 miles per hour? Probably not, right? Like, so, but if that's your goal, like, we can probably can try to get you there, right? And work on the things that you need to work on. But I think that the people that are probably listening to this are just your general population of, hey, I just want to live a good, healthy lifestyle until, my 70s, 80s, so on and so forth, and not have any pain or issues, right?
I don't know, Rich. You just gave me a new goal. You gave me a new goal to go after. I want to have a pitch 100 miles per hour.
Yeah,
I think
this would be awesome. Don't get me wrong, that would be unreal if you could.
Here's how it's like. Not only is it like unreal, not only is it very unlikely, but unrealistic. Me throwing a ball forehand with my right shoulder right now would be an accomplishment because my shoulder does need, I have been doing more therapy with it and it's not super stable. So that's my goal. Hashtag 100 mile goal, 100 miles per hour goal. But I love that. So let's finish up here. You had mentioned the NBA. I'm curious about anything else. Was your NBA? What is your most recent ambition? What gets you really excited down the pipeline here?
Yeah, so I've been doing the MBA. Just my concentrations are in leadership. I have a bit of an entrepreneurship, and then I'll have a few electives, which I might just kind of focus more on the sports science side of things, where understanding physiology better, just because I got to take some courses. But the reason why I'm doing it is a number of reasons, but one of them being just running my clinic itself, just to run it more efficiently, better, also just to be a better leader, right? As I try to grow and get more clinicians under me working, but more so trying to change therapy itself, where there's a lot more one-on-one quality time. If you have the money, like the vast majority of people don't have money besides your third-party insurance to, try to fix any ailments that they have, whether it be their shoulder, back, whatever it is. So at least if you can come see someone, which is affordable, we can get you set up with a good at-home program where you don't need to see someone once a week, right? It's, hey, do this for the next 2-3 weeks. Let's check in where you're at. So I really just want to try to change how therapy is done, where it's not that model like we started this off, where it's, hey, how are things going? Okay, perfect. I'm going to hand you off to, this student or, whoever, and they're going to take care of you, as opposed to having that one-on-one time, figuring out what your goals are, educating your patients. So that's my biggest thing is I really would like to see a change in that therapy model, where, you can actually spend quality one-on-one time with an individual. Because I find figuring out what their goals are is one of the biggest things, as you would know. And getting to really know someone, and then once you know someone, then you know how hard to push them, right? Hey, maybe I can push them a little bit harder here, or you got to ease on back, and then find out what, like, a program that works for them that they can do properly at home, right? Because if I give you some exercises and you're not going to do it, you're not going to get better at home. So why are we wasting each other's time, right? As opposed to it's, hey, I like that, I feel good after this exercise, perfect. Let's incorporate that and touch base down the road. So for me, trying to change that therapy model is one of my big goals and what I focus on right now.
I love that. That's a really valuable thing, and especially like you say, changing the therapy model, make sure people are able to do what they need to at home to actually have a long-term success. I love seeing that because I've definitely been a part of the therapy model when I was younger. I had a therapist I saw for maybe even 4 months, or I don't want to say 4 months, 2 months for sure. And it didn't change for the last month. Like I would even say in the last while, it was just always the same thing. And then finally going to see different therapists, and you were one of them, where I finally felt like, wow, this is different. This is progressing. This is getting me out of my problem. And I was able to take the exercises you gave me. To this day, T-spine rotations are fundamental tools in my toolkit because of what you'd shown me, and it makes such a difference. So why don't you actually let the listeners know where they can find more about you, Rich, and your clinic?
Yeah, absolutely. So we have our Instagram, which I do believe is Perimeter Therapy. Should probably be on top of that, but Chris has been running that. And then we also have our website, which is www.perimetertherapy.ca. And then if anybody wants to reach out and wants just to have a bit of a conversation, I don't mind if they email me as well, which is at info@perimetertherapy.ca. And if you feel like you want to, you can reach out to us and we can kind of get you set up with any kind of pain, or if you have any specific goals in mind, and see if we can actually help you.
I love it. Yeah, definitely go see him. I've seen him many times, and I'll probably see him again soon because this right shoulder ain't doing so good. So,
yeah.
All right. Thanks so much for joining me today, Rich.
Anytime, buddy.
Thanks again to Rich. I really enjoyed hearing his feedback on all of these ideas I had over the years. My favorite was talking about ice. I thought it was very valuable because I was even jumping kind of on a bandwagon, so to speak, that I thought ice wasn't really useful. I thought it was kind of starting to be overrated, but he kind of clarified it for me. He's like, it might still have a use, and people are jumping on research that might not be as valid for everyone, so there could still be a use for it. And then he was also very careful not to speak out of context and say that it's a blanket statement for anything. Whatever the problem is, he's like, well, it depends. It depends on what the problem is. Is it a flexibility issue? Is it a mobility issue? Is it a stability issue? So he was very careful. And I think that shows the importance of how much he takes care of his clients to make sure it's very suitable to the individual. And I think it's super valuable for people to understand the context of how some of these tools do work in. I think more people should consider the usage of foam rolling, lacrosse ball, using these massages, and then using it in a way right after to do some sort of a dynamic prep and then use the muscle. I think it's really a simple, fundamental way to work on injury prevention or treatment is to loosen and get blood flow to the area of a problem. And then you want to actively stretch the muscle in that. So as I say actively, that would be the PNF that we were referring to. So you would do a contract, relax in some sort of a state, and then you use the muscle. So do a movement pattern or a stability pattern so that the muscle would then need to remember it. And that is how you're going to see a lot of different therapy programs more newer age, I would say. It's just the more new way of doing it, but it's a very effective way to do it, to mobilize and to use it. And so I think that gives you some really good fundamental principles to understand if there's something that's not quite optimal for you. But at the end of the day, as Rich did mention it, get it checked out. This is the one thing that, even I make the mistake of quite often, is I will not pay attention to the injury for too long, and it goes a little bit too far, and then it's like, okay, I'm just in too much pain, I gotta go. So before it becomes too much of a problem and you get into compensation patterns, again, as Rich mentioned, you might just start favoring something and it causes a problem in a different joint. And so you got to be careful. And so if you can, try to get the help that you need and make sure they're very effective. And if you're in the Winnipeg area, I highly suggest you go check out Rich. He's on Perimeter Therapy. It is at the Hockey for All Center, no longer called the Iceplex, which is at the west end of the city. And he works with people individually, as we talked a lot about at the start. Having that one-on-one is super important and very valuable because he's no different than a trainer, but he's training you for your recovery. So I highly recommend you go check him out. Check out the Instagram page, as they have more stuff updated on there. And I really hope this helped. I hope this gives you some good guidance on what you should understand when it comes to injury prevention, what kind of concepts you got to be aware of when it comes to actually preventing your injuries or treating your injuries, because it's not even a question of if you're going to get hurt, it's when, most of the time, most people. And so we want to have some good education on this ahead of time. And thank you so much for listening. If you really enjoyed this episode, please leave a 5-star review or whatever you think the review honestly deserves. I'll give you open to that, but I appreciate the 5-star, and share it if you think that it's going to help anyone else, because I do want to spread this word. And I'll say it as I've been saying this in all my episodes recently. Thank you for listening. I appreciate you as a listener. I'm here to help you chase your own ambition. Life is not about the pursuit of happiness, my friend. It's about the happiness within your pursuit. And I'll catch you next time.